Welcome back and thanks for being there. Knowledge, like you know, they say is power. And when it comes to our health, it is a lifesaver. Today on Softline, we are shining a spotlight on the essential health screenings that can make all the difference in preventing, detecting, and managing diseases. So joining us is Dr. Kalu Nnenna Okore. She's a consultant family physician with the University of Uyo Teaching Hospital. She's also the chairperson or the chairman of Softpod, the Society of Family Physician of Nigeria. She'll be shining a light on the most known facts. She will debunk common myths and empower us to take charge of our health. So let's get started. Dr. Nana, you're welcome to the show.
Thank you, Nancy, and it's always a delight to be here.
Welcome, doctor.
Thank you, Young Edidion. Also, my pleasure. I got that name.
Yeah, you like the
did.
name.
You did.
Yeah, then.
All right, so this topic is very important, right, doctor?
Very important.
Very, very important
Very
because
important.
sometimes we just go to the hospital, we don't even know what we are. Like, you're okay, they say you should know your numbers, you should do some certain tests, but so many persons just go to this hospital, don't even know what to demand for, right?
Perfect.
So as we are aging, what are those important screening we are supposed to take,
That is very important.
that is very important, that we should do or we should go to the hospitals for as we age?
Okay, thank you very much,
You're
Nancy.
welcome.
Like the topic said, essential health screening.
Mhm.
Essential means very
Important.
important, right? Then screening is a tool that you use to detect or identify people who are at risk of having a particular disease,
Mhm.
right? So that you could be able to curb those diseases from
Early
actually
enough.
manifesting, yes,
Mhm.
early enough. So you can be able to curb it, nip it at the border, and help prevent further complications.
Mhm.
So now your question is, what are those things that we need to do?
Mhm.
Now, most of this screening that we do is based on your age of the patient,
Okay.
sex of the patient, the lifestyle, and then those who are at risk of having those diseases.
Okay.
So now, based on the age, now let me start with the adults who walk into the hospital. Like you said, knowing your numbers is very important.
Mhm.
You need to know your health, your weight is very important, your height is very important. That will give you an idea of what your body mass index is like. That's the BMI.
Okay.
Now, if you know that BMI is categorized into normal,
Mhm.
overweight, and obesity, right?
Mhm.
So now within 17 or okay, less than, I think
20.
it's no 18.5 to 24.5 is normal.
Okay.
Now 25 to 29.95 or 99 is overweight.
Okay.
Then obesity is from 30 and above.
Mhm.
And obesity is divided into class 1, class 2, class 3.
Okay.
Now, when you know those your numbers, you know that those are within normal weights. Yes, you're not. You're not at risk of having diabetes, hypertension, dyslipidemia.
Mhm.
But you're on the overweight side of obese, then we need to be very careful. We need to be monitoring those.
Mhm.
Then, in addition to checking your height, your weight, and that's your BMI, you also need to check your blood pressure.
Okay.
Now, for people who are at risk, at low risk, it's encouraged that you check your blood pressure at least once every year for those who are normal weight. Then, but for those who are at risk, you should do more often, right? You can every time you come to the hospital, that's what we do. Anytime
Okay.
you walk into the
Yeah,
hospital,
taking your vitals.
that's part of the vitals is your height, your weight, your blood pressure, and your pulse. Now, that's giving us an idea of how you're going to categorize this person and then how to monitor the patient, right? Then the other thing you need to do is your sugar test.
Okay.
Now, for those who is advocated for diabetes or for people once they're above 35,
Okay.
always do your sugar screening test. And then we can either use the fasting blood sugar or what we call the glycated hemoglobin. The glycated hemoglobin gives you a better idea because it's more like a retrospective test that shows you what your sugar is for the past 2 months. Unlike the fasting blood sugar, which it's more like what you just ate the previous day, right? No, what you ate. So it doesn't give you that clear picture. Now, if I eat something that is very high glycemic and I come the next day to check my sugar, it's expected that it might spike up. But a glycated hemoglobin is something that has been done for the past 2-3 months, so it gives you a better idea of it. Now, for normal people, expect your glycated hemoglobin, that's HbA1c, to be less or equal to 6.5%. But anything above that, then we need to screen further, right? But for sugar, for fasting blood sugar, we can also use what we call random blood sugar. Now, if you've eaten, you can check it. But now they have the different ranges. Now, for fasting blood sugar, the normal is within 60 milligram per DL to 100. Some people say 1 or to 126 milligram per DL.
Okay.
But anything above that is it needs further investigation. Then for random, it should be less or equal to 200 milligram per DL. If it's above that, then you need to for further testing. Then we need to check your lifestyle and all those things. So now the essential things for any adult that walks in, we check your vitals, which involves those I've mentioned. You check your blood pressure, you check your fasting blood sugar. Then the lipid is very important, which most people don't do. Lipid profile is checking your cholesterol. Well, a lot of people don't do that, but it's very important because it helps you to identify those who are at risk of cardiovascular diseases, right, or accidents. Now, in the lipid profile, there are 4 parameters we look out for: the total cholesterol, the triglyceride, the high density lipoprotein, and the low density lipoprotein. Then the high density lipoprotein we call it the good cholesterol,
the good
right?
cholesterol.
Yes, the good cholesterol. So when you do that, lipid profile is a prerequisite once you're above 35 or 40, yes. At least do it once a year. It's very important. Then for women who are within the childbearing age, from 21, now different schools of study said 18 years, but some school of study will say from 21 to 65, right? You do what we call the cancer screening for pap smear, for cervical cancer, where we do pap smear. And it's advised for such women, you do it within every 3 years, 3 yearly, right, for pap smear. Then for those who are high risk, who are the high risk people? Those are multiple sexual partners. Then women who marry to men that are not circumcised, right? Because circumcision helps curb this cervical cancer for women. Then women that have multiple sexual partners, young girls, then risk of having a lot of STIs. So you're at risk. You need to be doing your pap smear maybe like once a year. Then another test you can do for women is once you're above 40, the mammogram. Mammogram is done for if you're less than 40, no, you shouldn't do it. But once you're above 40, you should do it once in 2 years. 1 to 2 yearly. So depending on your risk assessments. So because they believe that when you are younger than 40, your breast is a bit dense. So the mammogram might not give you that clear picture. Yes. Because of that, collagen and all those things. You're younger. But once you're above 40 years, it gives you a clearer picture.
That mammogram machine is not easy. I just had to break that in. It's not easy, I must tell you.
Because of they really need to be pressing it. It's quite it can be very, very uncomfortable and painful. That's the word most of the patients describe it as. But it's when you look at the benefits and the risk, you just close your eyes. Within 5-10 minutes, you'll be done, and then you get done with it. I had a friend of mine, or rather a patient, who had done a mammogram, and she didn't know. But it was when the mammogram result came out that it was suspicious that we had to start. So she didn't do it. She just woke up and like, doctor, I want to do, I've been hearing about this mammogram. She was about 40. So it was the right thing, and we were able to nip it at the border. So it was her luck. But some people will run away from doing that probably because of what they heard is painful, and then I don't have any symptoms. So what are we looking at?
And the financial implications.
It's quite expensive, right?
It is, but I think it's about 27,000 thereabouts. Yeah, but someone said one of my patients that wanted a mammogram recently said he went to one private hospital and it was like 50K, so she ran away. So I asked her to go to another place and it was 27,000. But when you look at it, it's better. But for those who cannot really afford the mammogram, but though ultrasound can never take the place of a mammogram, right? It can never, yes. But instead of being in the dark, it's better you do an ultrasound of the scan of the breast, right? It will help you. But mammogram is a prerequisite for women who are above 40 years. Then for the men, once they're above 40, we do a PSA for you. That's the prostatic specific antigen to rule out the prostate cancer, right? But though different studies say PSA is not really specific, but it gives you an idea because there's a range you expect from this man. The normal range is 0 to 4 nanogram per DL. So when it's above that, then when it's between 5, above 4 to 10, you're thinking of a benign lesion. But when it's above 10, you're thinking of more of a cancerous thing. But once you have an elevated PSA, you need to subject the patient further to a lot of tests. So these are the things we need to do. Then for they're different, like I said, the screening depends on the age of the patient, the sex.
All right. So you've told us for that of men and women, which is very nice.
Yes.
But how about children?
Then for children, generally, we do growth monitoring depending on the age. We have the young children and we have the adolescents. Now, I'm going to talk about the young children because the adolescents too are within. How will I put it? When we discuss in the office, like adolescents are neither here or there, so they kind of we need to consciously make an effort to put them somewhere, because they are in the middle. Number for children, you do growth monitoring for them.
Okay.
The children less than 2 years, you measure their weight, their height, right? Their head circumference is very important, so they can roll out those that are at risk of having hydrocephalus, that's big head. Yeah, so you need to monitor. Then it will also help you to know those who are having failure to thrive or stunted. And then for children too, when you measure the height and the weight and plot it against their growth and the graph, you'll be able to know those kids who are obese. Childhood obesity is becoming a norm now. But for some parents, when they see their children, they say the child is healthy. But that's not nice. And that's a child that if you don't put an additional attention or extra care, that child will grow up being obese and start having issues. So it's better at this age, you start early to start cutting it down, right? So that will help you to know those kids that will need further this thing. Then for kids too, you check their immunization history. It's very important. That's part of the routine screening we do for them, right? Then for children, basically, depending on the disease entity they present with, that will help us tell the kind of tests we'll subject them to. But for adolescents, like I said, now adolescent, like I said, they said between 13 years. Some people say 12 years, 19, right? That teen age. But those people are at risk of a lot of things. So in addition to, we should also do blood pressure for them. But we don't routinely do that. We should do that for them because you'll be able to identify those who have early signs of hypertension. Yes, they should be. That should be done. Then you should also subject them to check their height and their weight is very important. Vital signs is very important, so you can calculate the BMI. Then for adolescents, we also screen them for substance abuse. Very important. And then you also screen them. A lot of, like I said, they're in the middle. So the tendency of them being neglected is high, right? So what do we do for them? You also screen for depression and anxiety. And how do you do that? This is where confidentiality comes in for adolescents. Now you treat them with so much care. When they walk into your clinic, you don't, you know how the music clinic is, you just give them that attention. If not, they won't open up to you. So if it means you taking them to a corner where they feel, you try to establish a rapport and make them win their trust so they can confide in you. Then you can ask those your questions. Elicit or identify those who are at risk of depression, those who are at risk of anxiety disorder. You'll be able to help you guide in your management. And then substance abuse, there are some questionnaire that you use to ask them about the substance abuse. There's one questionnaire tool that we use, we call it the CRAFT tool. Where you talk about, the C stands for, have you been in a car where either you were the driver or somebody was driving and the person was high? These are the subtle questions. I think it's a 6-tool question you ask. That will help you tell her if this child is prone to substance abuse or been taking alcohol or not. Then for adolescents, very important, STI, sexually transmitted, because they're reproductive age, right? And at that age, most of them are at risk. Or they like to try out things. They like to try out new things. So you need to find out if they're being abused, or they're even the ones abusing people. And then there are risk of infections, chlamydia, gonorrhea. So you need to run those tests for them.
Wow.
So all this is, like I said, the screening depends on the age, the sex, and the risk factors involved.
Wow.
This is very informative, doctor. But you see, while you were listing all of this, and I've really learned, my worry now is, my concern, not really a worry, my concern is to that neglected group, the adolescents. Yeah. How can our society, and even your, like you said, when you discuss in the hospital, you group them as the, how do you say people group them?
They are neither here or there.
So what can be done so that one can be intentional about checking the signs, especially the depression and substance abuse, which is very key. You would not see that as a routine in a clinic anywhere, both private and
Government.
government owned. Not even when such people fall sick and they're being
Routinely ask them.
presented for.
That's true.
So how can that be done?
That's a very good question. And here in the teaching hospital where I work, in my department, family medicine, we were trying to like carve out an adolescent clinic, right? Because that would determine a lot for them. Adolescent clinic, because like now, let's say someone is 18 years or 19 that comes in. If the child is, person is above being seen by the pediatricians, and then coming to the adult clinic, you have a lot of patients waiting for you. So that's time frame. You know, that's attention will not be there. So what we need to do that will help us with these adolescents is for us to carve out a clinic for them. Well, maybe if it's once a week, you just know that the adolescents who are coming, you have a specified time for them. You try to relate with them. And then we also advocate for parents. Learn to talk to your kids. Let them be your friends, right? Let you be their confidant. Don't be too judgmental. Even us as adults, both clinicians and other people, don't be fast in judging people or labeling people. It's not really good because it will make them open up to you. And it's like we said, this group are passing through a lot. So when you don't open up to them, or when, okay, like I had a case, let me give you an instance. This girl is, she's 23. I saw her in the clinic, was it yesterday, being Monday, and we got talking. So the mom who brought her said, hey, doctor, there's something I need to tell. My daughter is always frowning her face. So, and I don't know what is wrong with her. So at that point, I knew there was more to it. So I had to tell the mom to excuse us, let me talk with her. And I told her whatever she tells me is going to be just between the two of us, she should feel free. And she opened up that she wants to go back to school. She's the last of 5 kids. Apparently, when 2019, when she had entered school, she had a problem, health challenge. So she had to drop out. Now she's ready, but there's no money. So she's feeling kind of being marginalized, not loved. So it makes her a little bit sad, aggressive, depressed. So when we finished talking, I had to call in the mom. I said, she's your responsibility. Even you just find a way to send her back to school. That's her desire. Don't deny her what she wants. Encourage her. Yes, something happened. It wasn't her fault that she fell ill, right? But right, this is what is her desire. Just give it. That's why she's fanning her face. And she cannot be happy if she doesn't achieve that.
Okay, so the fanning now, what does that mean? Like you're fanning your face?
Frowning. Very sad, always not happy. She doesn't smile. She's a bit irritable, right? Another patient of mine was complaining about her daughter. And that one, like I say, she's not more adolescent. She has passed that age, maybe 23, 25. What happened? She had finished school, was not job. Now she's back home. Someone that used to be very lively, happy, is now a little bit withdrawn and sad. So these are signs of depression.
Meaning it could also be that the her family is not so comfortable, convenient for the child.
She's not happy that she's back home to come and just sit down idling around, right? Then these are the things. But the parents are not saying it. They're saying what's wrong with her? Why she's like this?
She shouldn't be like that because she's at home.
I just had to tell the mom, be a little bit patient with her, and then encourage her. Encourage her that it's just a matter of time she get a job. And then you help her out. If there's something she could be doing, right? Most of us being judgmental, like, after all the things I'm doing for you, why are you sad? Am I not trying for you? So you make it a little bit more withdrawn and she won't open up to you. So we need to be very sensitive. Now we have, for the adolescent, like you said, now these are adolescents within the teenage. For girls now who are seeing a lot of things, we all know that when you're seeing your period, we have those mood swings. So at that period where you notice that your child who used to be very lively is a bit irritable, snapping, withdrawn and all those things, if you are very observant and quite close to the child, you understand maybe she's having premenstrual syndrome. You just ask her, when was the last period? Or when? So by the time we ask those questions, we're able to know, okay, this is a hormonal thing, so it's just a time frame. You overlook some of her exercises, or you encourage her to tell her that these are the things that will come monthly. It's normal, so don't take it personal. So these are the things that we as parents, we need to be more sensitive and closer to our kids.
All right, so doctor, I want to ask you one question that is a bit out of what we're discussing.
Okay.
What's the youngest age you've seen for a girl menstruating?
I've seen up to 9 years.
9 years.
Yes.
Is it common?
Yes. And there are some people that have what we call precocious puberty. Precocious puberty means maturity earlier than the normal age or frame, the range, the age range, right? And a lot of things can cause that. Obesity can cause that. Child diets, maybe it could even be genetic, those that have the big frame, right? Like I think my daughter started seeing her period at 9 years. For me, I started at, was it 13 or 14 years? So, but she has that big frame. And the diet we feed our kids too. That's helping them see the period earlier than expected. So that's why for sex education, we don't wait for them to be of like teenage. You start early. And that's why I like most of these schools now. They start early to start teaching children, even in the nursery. Yes, sex education, health education, knowing yourself, knowing your body, knowing the limit where people can actually pass. So that will help the child. You start early to inculcate those ideas in the child. Yes, it will help.
All right. We'll go on a very short break to give our guests a little breather, and we'll be right back. Stay with us.
Step into the heartbeat of the world where news meets real talk. From breakthroughs in diplomacy to humanitarian challenges and scientific milestones, Global Digest takes you beyond the headlines and straight to the heart of the matter. I am Amma Marcus. Be a part of the world unfolding stories at 3 p.m. on ADBN, channel 258 on DSTV, and Star Times, channel 140. Global Digest, your window to the world's current affairs, only on Advocate Broadcasting Network.
All right, thanks for being there. So we still have Dr. Nnenna on the show. She's talking about the screening, different ages for different screening, and the most important thing she has talked about today for me is talking about the teen, the pre-teen. And I remember one time we had the psychology here with us, when we were discussing, he mentioned that if you go to the hospital, you get a section for pediatrics, the small for babies, and you get a section for the elderly, but you hardly have any section for the teen.
Yes.
That age group. It's as if they've been neglected in all aspect of health or whatever. So I'm glad you made mention of those things, those screening that are very important for the teen. All right, so when you take a look at your patient, when you have a patient, how do you determine what kind of screening that patient needs?
Okay. It's a very important question. Anyway, that depends on when the patient walks into your consulting room, right? There's a period where we do more of our history taking.
Okay.
So in the course of your history taking, you're going to find out what brought you to the hospital, your complaint. Why are you here? What can I do for you? Patient tells you, I have this, I have that. Then you need to elicit the course of that illness the patient is talking about. Then the likely complications. Then the care the patient has been able to assess. And then the other things are, like I've talked about the complication, the 5 C's, the cause, the probable cause, CAUSE, probable cause of it. Now, in the probable cause of it is where those risk factors come in. Do you understand? Possibility, as in what are the likely causes of this symptom the patient is presenting with. Now, for someone who comes in with headache, I can't sleep at night and all those things, your mind is going to different things. What could be? Is it a migraine headache? It could be hypertension. Now, in the course of your history taking your history, then you also elicit what we call the 5FE. That's why family medicine is very unique. In the 5FE, that's FIFE, we talk about the illness experience of the patient. Now you're bringing the patient, you're involving the patient in your management. Now, because in the 5FE, you want to elicit the fears of that patient is very important. If a patient walks in and you're not able to address his or her fears, you've not done anything. Then you want to know what the patient's knowledge about this symptom he or she is presenting with. Then that will also help you down. You're able to, someone will tell you, I think it's because I quarrel with this person. I think it's because I ate this, So that way you're assessing the patient's knowledge base. Then you also want to know how those symptoms are affecting the patient's functionality, and then what the patient expects from coming to the hospital. That way, you've been able to, that history, from your history taking, you've been able to gotten some things, that will help you in your request for the kind of test. And when you now run or do some physical examination, now you check your blood pressure of this patient and it's off the roof. Now, hypertension is, the new teaching is when it's the systolic is above 140 and the diastolic is above 90, right? And then you do a repeat one, it's still the same thing. That will help you to know, okay, what this patient is hypertensive, I need to do. What could be the possible cause of this hypertension? That's how you now subject the patient to further tests. You can do an ECG depending. If the patient is also complaining of chest pain, palpitation, you have to subject the person to ECG. Then you do that lipid profile we talked about earlier on, because these are the things. Hypercholesterolemia or dyslipidemia can also predispose to that. Do you understand? So you also need to check basic test urinalysis. You know, urinalysis, there are basic routine tests that we need to know. It will help you pick up some things. Is there protein in the urine? Is there sugar in the urine? Right? That will give you a clue of what could be the wrong with the patient. Then you also go ahead to do, for hypertensive patients, I've talked about ECG, chest x-ray, depending. Now in the chest x-ray, you want to find that because you don't want to keep exposing patients to radiation. So you have to tell out your need based on what the patient is presenting and your what we call that it's not your diagnosis, but what do you call that? When I remember that it's no differential diagnosis, right? Differentials, but you've not gotten to the real, not confirmed. Is when you now subject the patient to test, then you're now confirming your diagnosis. Yes. So when you're able to do those things, then after the chest X-ray, you can now subject that. Talked about urinalysis. Depending on what the patient is presenting with, that will help you know the kind of test you subject patient to.
Culture and all of that.
And a culture now, if the patient is telling you, I'm having pain when you're urinating, right? Then you're thinking of, is it a urinary tract infection? So I need to culture to know the microorganism that is responsible for it. But though urinalysis can also help you, give you an idea whether it's a urinary tract infection, because if you do a urinalysis that is it could be done in the hospital, in the clinic there. You just collect the urine and dip and then put it in a comb. It called combinine. If you see nitrites or leukocytes, it is an infection. So you're now subject further to do a culture. So that depends on what the patient presents with.
All right, let's take some few tweets and then we'll come back to you, doctor. We'll have our first tweet here from Luke. And then Luke says, did you know not everyone with diabetics looks sick?
Exactly.
Health isn't always visible. That's why checkup matters. And then this one from Dr. Chinam. So he said, you keep ignoring red flags like you are colorblind. That constant headache, the bloating, the fatigue. Listen to your body. Go for a checkup. The next one says, the medical checkups is a must to do yearly, especially if you are 30 and above. Not just to detect diabetes, hypertension, or high cholesterol, but sometimes we detect people with abnormal liver function tests after taking herbal supplements. And then this one from Hannah says, hi, here is a reminder to take care and keep up with health beyond diet and exercise. Yeah, because some persons, they think your diet and exercise is the key. Once you maintain those two, you're okay. Blood works for hormone and otherwise, sexual health, dental health, etc. Set up the visits or go to the clinic you have been avoiding because your mom can't schedule your appointments anymore. And the last tweet here says, your body and health is worth more than your car. Make it a point of duty to invest in your health. Do checkups regularly and don't ignore any strange symptom you notice. Okay. So which one of them would you like to react to? But let's talk about the exercise and dieting.
Okay.
You know, people tend to think that this is the cocoa.
Because you're exercising and because you're dieting, you're free of. That's why you need to do all those things. Like we said, why do we do all those tests? You know, there are some genes that one have in his or her body that could be a pointer to this. So even if you are living a healthy lifestyle, that shouldn't stop you from
going for checks.
Yes. Because it will help us identify, because they're like they said, there are some illnesses that will not present until very late. Now, for those who are, hypertension, like they said, doesn't even give you a sign. Diabetes, by the time you become very symptomatic, it's already off the roof. Some people, it doesn't even give them sign. I've seen a patient that walked into the consulting room. The blood pressure was 280/150. And she didn't have any symptom. She just came at, I think it was something related to her menses or something that she came for, right? But it wasn't her BP. Well, the BP was off the roof. She didn't know. Why some people could be hypertensive, just a little bit spike in your blood pressure, you start having headache, blurring vision. I forgot one of the things too we should do routinely is our visual checkup.
Okay.
It's very important. Yes, because like the issue of glaucoma, it doesn't give you sign. So you see someone that was seeing and suddenly the person goes blind. So you need to do your visual acuity, your visual eye vision should be done on a yearly basis. Then for your you should also go for a dental checkup. They advocate that it should be done at least every 6 months. But most of us don't do that. Because there are cavities and all these stuff that people see, and they see someone when you smile in public, it's really not too palatable to behold. So people need to go for that. It's not because you don't have, it's waste of money. People feel that when I'm not symptomatic, so why should I go to the hospital? Why am I going to waste money? But we're trying to prevent a lot of things. It's not when you develop cavities, and you now start having toothache, and you're in pain, you now seek help. But when you go early and they're able to do, they'll do what they call that, they'll flush your teeth, dental floss and all those things, and wash your teeth for you. It's better for you. It helps you to curb the risk of having cavities. Then another thing is your ear check. Audiometry check is very important. And especially for those, there are some companies, it's a prerequisite for most people who work offshore, right? Because of exposure to noise. They always go for the audiometry every year. That way you check those who are at risk of having hearing loss due to exposure to loud noise. So we should be doing that at least one or twice yearly, 1 or 2 yearly, do you understand? But we don't do that, and people don't actually ask for it.
You know, you said something about, sorry, Eddie, you said something about people saying, I don't present
I don't have
any
symptoms
or what. So are there other myths or misconceptions you would like to debunk when it comes to screening?
Yes, some people, okay, like I said, number one of the misconceptions is I don't have symptoms, so why am I going, right? Then some people will feel, okay, I've done the test once and it was negative, so I'm going to be negative forever. But you forget the fact that as you age, and with the different lifestyles you're having, you're prone to a lot of things. Your body is changing too. So those diseases will come up. You see someone who was very healthy, and then by the time you clock 40, 50, you start having issues. And for women, even for men too, I forgot, we should also be doing bone mineral density just to screen for osteoporosis. We don't routinely do that, but we should be doing that. Because for women, once you hit that menopause, estrogen level drops, your bones become brittle. So women are prone to osteoporosis as we age. But one would do that bone mineral density helps, and then it will also help us to know those stats, some of these multivitamins like vitamin D3 or D to help you in your bone, and the calcium. It's advised that women, once they're above 40, should be taking vitamin. There's a range of vitamin D that you take, I think within 400 to 1,000 microgram. No, 1,000 millimole. Is it microgram? Yes. Then once they're above 50, you increase it to about 2,000. It should be a daily thing to help in your bone. Then the same thing for calcium. Your daily requirement for calcium is about 1,200 milligram. So these are the things we need to do. When you see people now who are aging backwards, if you check very well, they have started this. Knowledge, you say, is key, is power. But no, ignorance is not an excuse. So with these things, it will help people to be very conscious about their health, and they start early. Another misconception people have or myth people have about this routine check is nobody in my family has it, so why should I? But you don't know that some illnesses that skip generation, right? Yes, the illnesses that skip generation, and you'd be like, okay, my mother doesn't have it. My grandmother didn't have it, so why should I have it? Right? It might skip those two and come to you, and you'll be wondering, did my village people remember me? so it's good for you to check. And then also don't forget the fact that probably in those days our grandmothers were not prone to all these fast foods we are eating and the kind of stress.
We'll go through now.
Yes. Now, because of the kind of lifestyle we are living, you wake up very early in the morning, you're off, you're back late, and probably you don't even eat anything. You eat more of junk. These are very unhealthy lifestyles. So you're prone to all those illnesses. Unlike our grandmothers, I'll go to the farm and pluck very fresh vegetables. They eat very good food, well-cooked meal, not fast food and all those things. Then you know the oil they are using. So they are more of kind of living a very healthy lifestyle than us. So if you're wondering, it shouldn't be because you are already stressing yourself. You know, so another misconception people have about this is I've talked about the fact that, okay, it doesn't run the family, or why am I going to waste money? It's
You don't
waste of
present
money.
any
Yes, I don't have
symptoms.
symptoms, or okay, I've done the test, it's next, so I wasted my money. But you're helping yourself because the thing is better you screen at an early stage and get those disease entity than when you start having complications, that you start needing dialysis. You spend times, in short, times 100 of what you are spending. So it's very important.
Okay, so doctor, having said all of this, it's very enlightening, but I'm worried.
Okay.
I've just been thinking, how do we take this advocacy to the less privileged? Because from all we have said, those who are able to afford the services to run this test would do it. Yeah, some would have the money and wouldn't still do it. Yeah.
And for those who do not have the money but want to do it, what do we do for them, right?
Exactly.
Anyway.
Because your department as a family health, I think, like you said, you people are family medicine, yeah. So, like you said, you people are advocating to have a teen clinic, adolescent clinic, which is, I think, it would be very interesting and very good to have. So, can you go further to seeing how you can help
those vulnerable
exactly that do not have?
Anyway, for now, like you said, health is expensive, right? But there's something the governor of Akwa Ibom is doing that I must commend him. Doing insurance, health insurance for people. So if people can key into that, it will help them. Do you understand? Even for those, health insurance is very important. Even without the state-owned, there's one the federal government does too. So you pay, yes.
Does it cover?
There's some tests it covers. There's some tests you don't have to pay anything. There's some you just pay, it's just a small amount of money for it. That way it will help you. Do you understand? And then how do we get people to know about that? This what you're doing like this. Television campaigns, radio campaigns, go to the market, churches, health education, just any gathering you see yourself, try to talk with women, talk to generally people, you know, and then advocate for them to be very careful about it. There was one thing they did about the elderly some months back in Akwa Ibom here, but it was federal government that was collaborating with the state government. And the crowd of old people that came was really amazing. I could see them coming with a lot of illnesses. Some didn't even know they were hypertensive. By the time we checked, their blood pressure was really off the roof. Some, the sugar test was really, and they had no idea. Why? Because of finance. So that opened their eyes. And then some that had an eye issue, maybe a refractive error and all those things, we were able to give them some glasses. Those that had issues with hearing, they were giving hearing aid. So such things from both the state and the federal government will help people too, especially the vulnerable groups. And then for those who are a little bit that are quite comfortable, we could help our people too. One or two people, just sponsor them, you know, encourage, do free health services. Like we do that sometimes. Society of Family Physicians, we do that. We do outreaches, and the cost of those outreaches will help them to find out their numbers. You know, find out some illnesses, and then we'll help them. We give prescriptions and encourage you to come to the hospital for us to continue the care.
Okay. So I would like to. Our next question is quite light-hearted. We're talking about trends in healthcare delivery. So are there any new trend in the healthcare delivery system that you're excited about?
Yeah, you know, before people were, before you must come to the hospital, you know, but we have these online things now where you can sit in the comfort of your home and then talk to some of the doctors who are into, so they'll listen to you, give you, you consult them, they give you prescriptions or tell you what the kind of test you're supposed to do, right? And then advise you to maybe go to a nearby hospital for follow-up. So these are the new trends now. You don't need to, and then this appointment slip, you can just stay in the comfort of your home and make a call, right? You know, and it's legalized in the sense that everything is being documented. Right, before you have to register in that platform, so that you can have your data and follow up. So these are the new trends now. Instead of you, and then appointment slip in the hospital where you don't just walk in, you book an appointment and come in. It helps to save time for both the patient and the physician, and it helps to prevent or reduce what we call this burnout on the physicians. So these are the things we're advocating for, and it's helping too.
All right, thank you so much, Dr. Nnenna.
So I'm curious, are there, for the online doctors, how do they manage the vitals?
Okay. You know, there are some Now, some patients, we encourage them to have their machines.
Okay.
Some machines you should be able, we call it self-check, like this electronic this thing. So by the time you teach them on how to check it, it could be talking with them,
Okay.
you visualize and you say
carrying-
yes,
okay.
you'll be able to say that. Even the glucometer check. If you teach anybody, you'll be able to do those things.
Okay.
Yes. And then you do a visual kind of consultation. So you're seeing what your patient is doing.
Okay.
So it helps you. If they're not tying the curve well, or they're not doing well, or not positioning themselves well, we help them put them through. Yes.
Okay.
I saw something the other day about somebody who performed a surgery in a remote place. I think he was in Rome and performed the surgery, remote surgery, on someone in Belgium, and I was intrigued.
Wow.
I don't know how he did it, but yes. So that's where we are now. Technology has really gone far. That we don't have to everyday paperwork and then go to the hospital. You can stay in the comfort of your own.
So where's the place of AI in this? Because I think AI.
I think it's even the AI that's doing
that's
that.
okay.
Yeah, exactly.
That's the technology. So let's talk about, just in 2 minutes, some of the challenges you see in the healthcare system now. I know there are plenty of them, but let's just give you the platform.
The challenges we see in the healthcare, like you said, there are plenty. Where will I even start from? Number one, and now a patient comes in, right? Apart from the fact that we don't have constant lights, yes, you might come in and there's no light to retrieve the patient's folder. Now we've moved into the electronic level now, so you need light for you to access the patient's folder and get those things. That could also cause a delay. We come to our laboratory. Those lab results that should be done there and then, get the result that will help you. There could be a delay in it, right? And then the issue of the patient too, most of them do not have money. And they come in, you can't even do much for them because everything at this stage, you need them to do this, pay for this, pay for that. And that could also cause a kind of a constraint in your management of your patients. Then one of the challenges, communication issue, will also be a problem. But that one, we're able to manage that one because we advise patients, if you know you can't talk or communicate well, come with someone that will help express. So a lot of things too. Then drugs, availability of medications, or even the ones you want are not so available, or the ones that are available are super very expensive for the patient. So a lot of things. Then you want something, okay, now let's say you have an emergency and you need to take the patient into the theater ASAP. There are a lot of bottleneck. It may not even be you, right? The lab people will need to run those tests and bring them out. And there are some basic tests that if you don't have those results, you can't take the patient. Because if anything happens to the patient, it's on your head. So those things can delay your management of the patient. And we don't have facilities too. We're talking about most of our hospitals not being well equipped. So these are the things that, although they even have the equipment, we don't have the things to sustain those equipments. Like I said, the light issue is very important. So most of, I'm sorry to say, but in Akwa Ibom here, I think it's only in Honor that they have a functional city.
Really?
And it's not really too nice. So now a patient here in Akwa Ibom, New York, will have to drive all down to Honor. Then the facilities that have may not be standardized. Probably they're giving you very not up to the standard you want. So the patient has to drive down to Honor. So what of those that don't have that, they don't have opportunity to Honor and all those things. The patient needs that city. It's a matter of the time frame. So these are the things, so we need to equip our hospitals. We also need manpower. Brain drain, doctors are moving, nurses are moving, everybody's looking for greener pasture.
I thought you were going to complete this talk without mentioning.
Now would I not talk? The brain drain is overwhelming.
It's coming last. That means it's not a major problem anymore.
No, it is. Well,
really?
The doctors or the health care workers are being overworked. They are being overworked. So, it's the brain drain thing is something that's been overflogged, and nothing is being done. So, is it something I'll start bringing again? We just keep hoping that one day there'll be hope for us, right?
All right. Thank you so much, Dr. Nnenna, for coming on the show.
Thank you very much, Nancy, and thank you,
Lydia.
Yeah, nice.
All right. Thanks to our guest, Dr. Nnenna, for sharing her expertise on essential health screening. Remember, taking care of your health is a journey, and regular screening can be a powerful tool in maintaining your well-being. So we hope you found this conversation informative and helpful. So until next time, from all of us in the studio, stay healthy and stay informed. Bye-bye.